OBGY has got two components or two parts. So there's the obstetric part and also there's the gyne part. So the obstetric part is basically pregnant women. Then the gyne part is for women that are not pregnant. So I just basically dealing with the female reproductive system in a state where it's pregnant, in a state where it's not pregnant. So the template is as usual. You've got the biography. You're just getting the person's details, no age, date of birth, straightforward things. Then you move on to the presenting complaint. What has actually brought these patients to the clinic or hospital? So I'll show you a list of complaints that usually present in the obstetric and it's also in the gyne history. So there are some women that are pregnant that to come with specific complaints related to the pregnancy. And there are those that are not pregnant, but they come with their own complaint. I'll give you a list just to give you an idea what's very common. Then you go to review of system. This is where I just ask about the body systems. So you're talking about the central nervous system, the cardiovascular system, the respiratory system. You're asking questions in the system. Because sometimes the patient will come to the clinic, but they are having a gyne problem. So for example, a young girl says she has been having menstruation for over a week or 2 weeks. But on top of that, they also have a cough. So it's not like you say, since you just came here for the gyne issue, then I'll just treat you for the gyne issue. No, you also have to manage the cough also. So that's where I am going to have review system, just to check other systems for the other problems. History of the present pregnancy, especially now dealing with obstetric. So you have a patient who's pregnant. We're going to take his history of the present pregnancy. You want to get more information about this pregnancy. Then now you proceed to the obstetric and the gyne history. So, for example, a woman comes in with a little of period cramps. They're uncontrolled with painkillers. So they come to this, they're not pregnant. But you're going to ask about their past obstetric history. How many kids they have, where the kids are cesarean section or things like that. So you're going to ask under this obstetric and gyne history. Then you go on to the medical history, surgical history, drug, allergies, family history, social history. Then you summarize, give a diagnosis and differentials. Okay, we're going to learn about some definitions before we get into the clicking or the history taking in OBGY. So you hear things like on the word, doctors will be saying this is gravid 4, para 1, plus 4. They'll be using these terms like this one is a para 3 plus 2, this one is a gravid 8. What does this mean? Then they'll ask, what's the EDD of this patient? So these are some of the things want to describe or define. Okay, so gravid means the number of times a woman has been pregnant. That's all. She has been pregnant 4 times. This is a gravid 4. So this is regardless of the outcome of the pregnancy. So in this one, we don't consider whether there's a miscarriage or not, whether the child is alive or not. All we are looking for is the number of times has been pregnant. Then parity is the total number of deliveries, either live or stillbirth after viability. So viability simply means the ability of the fetus to survive outside the womb of the mother. So this viability differs in different countries because it depends on the facility or the hospital where this child is born. So other developed countries, it go even as low as 21 weeks. But most developing poor countries have put it at 24 to 28 weeks. And because when a baby is born premature, the premature ones, they'll take them to the intensive care unit. And they need certain machines in these units to help support these premature babies because their lungs have not yet fully developed. So they need some support. So parity is divided into two parts, A and B. So the A is just a number of births beyond the viability. So depending on each country, like in this example, isn't 24 or 28. Then the B part is the number of miscarriages or termination before viability. So let's add some context to this. So you have a patient who's a gravida 4. So means she has been pregnant 4 times. But out of these 4 times, she had the miscarriage at 20 weeks. Yet, so miscarriage at 20 weeks, one of the pregnancies was a miscarriage at 20 weeks. Then the others past 24 weeks, and he delivered. So, how you would state this in relation to the gravida and parity, you would say this is a gravida 4 mother. So you present on the word this gravida 4 para 3 plus 1. So the 3, these are the kids that went beyond 24 weeks. And that 1 is the one that showed the miscarriage. Okay. So the next one is LMP. Simply means the last menstrual periods. That's why I want to get more information. So the definition is the first day of the last normal period. So if she starts her periods on 20th, so her LMP is on 20th. Then you move to EDD, expected date of delivery. When they expect this woman to deliver a child, that's what this means. So we're going to calculate this. We're going to use the LMP to calculate this expected date of delivery. So these days, they use apps. There are apps on the phone that you can download that you can use to calculate these days. But on the one, the consultant will ask you to physically calculate this on the paper. So you just calculate using the Gregorian calendar. Using a 28-day cycle. So you're going to write EDD is equals to LMP minus 3 months plus 7 days plus 1 year for a month, for months between April to December. Then, if I thought it's between January to March, you say EDD is equals to LMP plus 9 months plus 7 days. Okay, so now we begin history taking. So of course, personal information, where you're going to ask the patient's name, age, nationality, religion, occupation, marital status, then an address. So this information not just for the sake of writing. They give you a picture of a patient, the person you are working with. For example, age. This patient tells you that they are 40 years, 39 years. You know that you're dealing with a woman who has advanced in age, so most likely she's going to have some complications when delivering. Same thing with teenage pregnancy. Someone tells you they're 16 years, 17 years. You know that you're going to have some complications. during delivery. So even as you are planning for this patient, it's going to be different because of the age of this patient. Religion is the same thing. There's some people that refuse blood donation. So as you are planning for this patient, you know that, no, this patient does not receive blood. So you even indicate in your file, this patient coming from this region where they do not receive blood. So even as you are managing this patient, you know what to do. Occupation, marital status. Some people are not married, but they get pregnant. You also need some special management. So, for example, address. So where these people are living, there are some areas which are very prone to certain infections. For example, malaria. Malaria is very fatal in pregnant women. So you need to know where they're coming from and the diseases that are common in that area. But as you're managing these people, because pregnant women, you manage them for 9 months. So you need to plan well for these patients. And then there's even antenatal visits where you make up follow-ups, check them up, see if whether they are having any complications and to manage those complications. After that date of delivered, the EDD, which is then you deliver according to your plan. So this is the importance of this demography. Then you move to main complaint. So this one is straightforward. Patient will tell you, for example, when you're pregnant women, they have back pains. They will tell you, I wake up and only discover that my underwear is wet. I'm not peed, but I'm wet down there. And then they are pregnant. This may indicate a very serious complication. So you want to make follow-ups. Some told they have back pains, some they told they are bleeding and they are pregnant. These are serious issues in pregnant women. Some women, they're not pregnant, but they'll tell you, I haven't attended my periods for 2 months now. You test, you do a gravid index, they're not pregnant, but they are not attending their periods. So those are some of the complaints that women come in OBGYN. Now, of course, I'll show you a list of some complaints that they present with. And then, of course, you proceed by asking the duration. And then, of course, chronological order. If there are 4 or 5 complaints, list them like that. Then you move on to your list of presenting complaint. So you're just getting more information about the complaint that they have. So let's say they're having a blood discharge and they're pregnant. Want to know more about this blood that's coming out. That's when it started. Is it getting worse or better? Is it increasing? Is it dark or bright? There are so those questions that you want to know more about this presenting complaint. And of course, associated symptom. Is this blood related to pain or anything like that? So depending on the complaint that they come with, we're going to ask onset, the cause, the severity, duration. We're going to ask about increase or decrease in symptom, associated symptoms. Then you move to, so in this case of presenting complaint, you ask about other conditions. You ask about if they are hypertensive, they are bleeding, they are draining. So draining, this is where the patient will tell you, especially pregnant women, they will tell you that they wake up and they are wet. Or when they cough, they like urinate, but this is not urine. So these are some of the things that you want to ask. Are they having contractions? Do they perceive fetal movements? Or is like a baby in the womb moving? Those are the things that you want to ask on the presenting complaint. Then ask, are there any investigation that has been done? Because some of those women go for antenatal. And the antenatal clinic, they'll present with this complaint. Tell them, no, I'm having this and this. Then they'll do some investigations. They'll do some ultrasound, some blood tests. So you want to know all these things and write them down, and the result and what was done for that patient. Then any complications that you have developed. Then you move to review of system. So this one is straightforward, just like in internal medicine. You're asking about things that they have not presented with. So ask about central nervous system. I'll put up questions about this review of system. These are just straightforward questions that to ask. And then the patient will respond so that you are able to catch other conditions that the patient has, but for them they think it's not important. But it is important. So sometimes people grade what's important to them. So according to what's important, that's they'll present first, and others they'll put them below, and sometimes they don't even mention them. But as a doctor, I need to scan for those under way of real system. So basically just scanning the patient from head to toe. So now we move to history of the present pregnancy. So this is very important, and you need more details on this one, because this is one of the things that brings the patient to the clinic, and you want to exhaust this. And this is where the consultants on the ward round, that's where they will fire a lot of questions. So the first thing to look at is the menstrual history. You ask the patient, how are your menses? Are they regular? Do they come on the same day, like the previous month? Do they stay for the same period of time? If it's 1 week, the other month it was also 1 week. If it's 4 days, the other month it was also 4 days. You're getting this history. Are they painful or not? Is the pain manageable or not? This is the thing that you are getting on this is the present pregnancy. So in this case, I'm dealing with an obstetric patient. The patient was pregnant. So you want to know their menstrual history. So these are the things that you ask. Then you move to the last normal menstrual period, the current LMP. What you had asked previously, you also stated. Then you also calculate the EDD. You remember the EDD? This is when it's coming in. You calculate the EDD here, expected date of delivery, you calculate it. Then you ask any bleedings that you have had since we discovered that you are pregnant. You indicate, and describe what color the blood was it dark red or bright red? You list all those things. Okay, so that I go on and ask about if they are taking any contraceptives. How long have they been taking these contraceptives before they discovered they were pregnant? Did they stop? Then that's when they got pregnant. So you're asking about contraceptives that they used. Then you also ask about how they confirmed this pregnancy. Is it by pregnancy test or by ultrasound? Then ask, was this a planned or unplanned pregnancy? So, for how they confirm the pregnancy. So sometimes someone would come and they would do a pregnancy test and it's positive. But they're still wondering whether it's true or not, so they go for ultrasound. Now, at the hospital, ultrasound is very important in confirming pregnancy because it has got a lot of benefits as compared to a pregnancy test. Yes, it's going to be positive and the woman is going to be pregnant and will deliver after 7 to 42 weeks. The woman will deliver. But ultrasound confirmation is important because it shows a lot of information, like one, location, how old the fetus is. So it can also be used for dating the embryo. So it dates the pregnancy. You can use ultrasound, very important. It can also be used to see any complications that the woman is likely to have, how the fetus is growing. That's the importance of using ultrasound. Then Is it planned or unplanned? This is also important because if it's unplanned, they may want to terminate it. So you'd have to manage that patient in that area. Or if it's planned, you know that there's a way in which someone responded if it was planned. Okay, move on to asking about the antenatal visits. So in these antenatal visits, you want to know a number of clinic visits, how many times they have visited the clinic, the last day they visited the clinic, did they find any high risk factors? For example, hypertension in pregnancy is a high risk factor. It's really dangerous in pregnancy. So you want to know such things. What did they find during these visits? What investigations was done during these visits? And what was done if any complication or problem was found during these visits? You need to know these things. So you need to ask the patient. They need to ask or request for the earliest ultrasound report that they had gotten from this antenatal care or clinics. And of course, you have gotten any more information about any problems, all those things. Then we ask about the plan that was made for delivery. So in obstetric history, when getting obstetric history, you need to have a detailed plan. So how do you get the detailed plan? From all this history you're gathering, you made that plan. So when the patient is coming from the clinic, they should have a plan. Say, okay, we expect a delivery on this day. This is what we're going to do. And this is how we're going to deliver. You need to ask if there's a plan like that. And then about the number of children, like the validity of this a woman, how many kids that she has. So for every kid, if she has 5, we ask the following: date of birth, place, mode of delivery, or the time vaginal delivery, or to the cesarean section, or the child mature or premature, the birth weight, the sex of the child. How did labor start? Did they have any complications during labor? Or after labor, any complications as follows: the outcome of the delivery, or did they manage? Then ask about are they breastfeeding? Did they breastfeed the child or the children? And all those information is put together for every child that they have. So sometimes you have people who have 9 kids. You can just summarize this information when presenting. Then you move to past medical and past surgical history. So in past medical history, you are looking for conditions that can complicate the pregnancy. Conditions like heart diseases, hypertension, diabetes, epilepsy, thyroid diseases, asthma, kidney diseases. So you're just asking this may maintain TB. So you're asking conditions that may complicate this pregnancy. You ask those conditions. Then you move to surgical history. You ask about if I told that any surgery before, it means cesarean section before. So drug history. Just ask the patient what kind of medication they're taking, how many times, how long they've been taking this drug, the dosage, write them down. Ask about allergies. And then you ask about the hematinics. So these are just iron supplements I take basically for prophylaxis against anemia. So anemia in pregnancy is very serious. So you ask if you're taking any medications for blood. That's what they usually call them. And also ask if you're taking folic acid, if you're taking those drugs. So these are very important. Folic acid is important in the development of the baby. So you need to ask if they're taking these drugs. Then ask if they're taking any blood medication. especially in Africa, women tend to take some herbal medications. So I ask this because they may complicate the pregnancy. Then we move on to family history. Families are going to ask about chronic medical conditions, diabetes, epilepsy, asthma, hypertension, ask about such. Then you also ask about the obstetric disorders, family history. So there are some families that seem to have complications during childbirth. So like everyone in the family and all the aunties, the sisters have C-sections. So if you have such a history of this patient, you may want to plan for a C-section as one of the alternatives of delivery for this client. Some will tell you that everyone in the family has hypertension. So you want to start investigation for hypertension and look out for hypertension in this pregnant woman. Some will tell you that multiple pregnancy, tell you that she's a twin, the mom is a twin, the older brother has got twins. So in the family, they are risk of having twins. So she's most likely going to have multiple pregnancies. So she's likely going to have twins. So you want to also investigate and plan for that. And of course, other hereditary diseases like sickle cell, you need to ask all those things. Then you move to social history. Of course, the occupation, the income, level of education. So there are some women that are not highly educated. So you need to explain some concepts in a way in which they better understand in relation to their environment. So a lot of times students have this system of using medical language. Avoid using medical languages in these patients when you're clicking. Any patient that you're clicking, avoid using medical terms when you're talking to them. Just explain. You already explain to someone. In short, explain the already explain to a child. Simple English. So, a level of education is important. You need to know it. How is in condition, how they are living at home. You need to know how these patients are living at home. Then you move on to number of rooms, resources, water source, in number of people that the patient is staying with, sanitary facilities. Then you also ask about smoking and alcohol. These can cause complication in pregnancy. So you need to make sure you know whether the patient is a smoker or takes alcohol, so that you can know how to manage this patient. Because imagine someone who smokes, who drinks alcohol every day, and now she's pregnant. So you need to make sure you counsel the patient so the patient can reduce on alcohol intake. So they say they smoke. You need to know how many packs per year if they drink, how many bottles per day. And also if at all they abuse drugs. Another important thing that you need to ask these patients is domestic violence. Sometimes these patients may tend to be in environments where there's too much violence. So you indicate, and if at all there's any violence, you involve social services so that they can help these patients. And also some other special habits these patients have. And hobbies. So that you just know the patient you're dealing with. So summarize as the final part, summarize and you give a diagnosis. So in summary, you need to give the important positives and negatives. But these are dependent on your knowledge of conditions in obstetrics and gynecology. That's when you're going to pick out what's positive and what's negative. So a good example is you have a patient who's pregnant, and then they don't present with any bleeding, any discharge, but they're having abdominal pain. You'd want to state these things, that even though the patient is having abdominal pains, and she's pregnant, but she's not having any discharge, no blood, nothing. So the more you study these conditions, the more you'll be able to write a comprehensive and short summary, because you know what you're focusing. Because it's going to give a person reading this summary a picture of this patient. Okay. Let me give an example. Okay, let me give an example here. Mrs. Johnson is a 32-year-old housewife, married 7 years ago. So already you have picked the age, you have picked the occupation, so you know the person and the woman you're dealing with. And how long they have been married. So you see she's in a stable relationship. So most likely the husband will be there for her during all this period. So yes, in just this short part, giving us a picture of a demography of the patient we're dealing with, or the patient we are seeing. Then we proceed. G4, P2 plus 1. So this is graviда 4, PU2 plus 1, meaning she has had 4 pregnancies, 2 live births, and 1 miscarriage. You remember that the definitions that we had? So you are describing the gravity and the parity. So this is how we present the information. With 2 living children, male and female, pregnant at 36 weeks of gestation with a history of a C-section or breech at 10, presenting with an antepartum hemorrhage. She is admitted for further evaluation. So from here, we are seeing that we have also described the age of your pregnancy in this summary. So don't forget how the age of the pregnancy in this summary in weeks and days. 3 weeks, 4 days. Of 3 weeks, 1 day. You get this information from the expected date of the man. Yeah. Then you indicate she had a cesarean section, and the reason was because of a breast presentation. So breast presentation simply means the presenting part wasn't the head. So I'll explain more in other videos about this breast presentation. And then now explain what's wrong with the patient. So presenting with the antepartum hemorrhage. So she's just bleeding before delivery starts. And you state she's admitted for further management. And then in this summary, that's how your diagnosis is also.